Welcome to Morning Infusion with Dr. V. Have you ever wondered what it would be like to collaborate with physicians as a new nurse? Well, my name is Dr. Viola Pierce. I am the owner and CEO of VP Nursing and the Nurse Nurturer and the facilitators of Secret Suppers Worldwide with Dr. V, where our goal is to teach nurses to leverage the knowledge they already know, working from their computers around the world, making money and owning their own time. Our goal is to come to you each Monday, Wednesday, and Friday at 7:30 a.m. Eastern Standard Time to give you the fuel to crush your goals and show up exceptional on a daily basis. Know that one of the goals of Morning Infusion with Dr. V is to expose you to leaders who have overcome so that you know that the possibilities are endless. If you are watching on YouTube, don't forget to hit the subscribe button and leave a comment if you were ever told that you would not succeed. And remember to click the calendar link above if you want to create another stream of income and enroll in our 12-week course, VP Nursing Business Academy. Our special guest today is Megan Wayne. So Megan Wayne received a Bachelor's of Science in Nursing from Clemson University in 2013 and went to work in critical care. After a few years in the inpatient setting, Megan then obtained a position at Mercy Medicine Free Clinic, where she worked as the nurse coordinator. In 2018, she earned a Master's of Science with a focus in education from Benedictine University.
You got it. Yeah.
She is currently enrolled in the PhD program at the Medical University of South Carolina, and her focus is mental fatigue and the informal caregiver. She is an instructor of nursing at Francis Marion University in Florence, South Carolina. So welcome, Megan. Welcome.
Thank you. I'm so happy to be here.
I know. We're going to have a good time. So now, you originally wanted to become a doctor. Now, what about nursing changed your mind to switch your career track?
Oh, well, whenever I first went to Clemson, I was a biology major going, I'm going to be a surgeon, the whole big dream, like the white coats and all the fancy stuff. Because I always knew that healthcare was where I wanted to be, just because it's constantly changing and I get bored really easily. And so I was like, well, that's what I want to do. Let's go to med school. And so my first year on my undergrad degree, all our biology professors were hitting us with the whole look around. All of you want to be doctors, but only 1/3 of you are going to make it. You need to have a good resume and this and this and this. And it stressed me out. Okay. So I was like, I need to have a backup plan just in case this whole med school thing doesn't go through. So I was looking around at different things, and I happened to get an email from the nursing school at Clemson talking about how to change your major to nursing. I'd never reached out to them or nothing. They just sent it to me. And I was like, I don't know, because what's funny is nursing was one of the few things that I had ruled out in healthcare. I was like, that's pushing pills, doing paperwork. I think that's not for me. Then I got to thinking, I could still go on to med school and I could work my way through med school if I went into nursing. And so I started my nursing career, my nursing education at Clemson, and just absolutely fell in love with it. Because the relationships that you get to build with patients at the bedside are just different from anything that I could ever imagine having. I mean, I'm not saying that physicians don't have those same relationships, but when you're with someone for that long, over and over and over again, it's much more hands-on. And my perception of what nursing was prior to that was just completely wrong. It was just, this is so much more than giving them a couple of pills and doing paperwork. I mean, the skills just sucked me in. Like anything I could do with my hands, I was like, let's do it. And I was all over it. I absolutely loved it. And it was interesting to learn about. I still had the anatomy and physiology stuff that I really enjoyed learning, but with the added holistic piece that nurses get to focus on so much, and the advocacy that you get to learn about and really practice whenever you are a nurse, it really, really sucked me in there. So I was like, med school, don't need that. I think I'll just stick here in my white scrubs for a little bit. And
You
so
know what?
that's where I ended up.
It's interesting that you said it was pushing pills and and
Yeah.
paperwork, right? Because
Yeah.
the reality is that it is so much more. And I mean, it is amazing the amount of what it is, right? I mean, like
yeah.
it is, you can go from A to Z with the things that you can do as a nurse, right? Because you're a teacher at this point, right? I
Yep,
mean, you can do anything,
I
literally
know.
anything.
Yeah,
So that
there's so many little facets to nursing. Anybody can find a spot if that's what their passion is nursing.
that's
So I
exactly
was,
right.
yeah.
So now you were told that you did not need to do critical care. Why do you think nurses are told this when they first come out of school?
I think it's very much the mindset of, you have to pay your dues in med surge before you get to go play with the fun stuff in the ICU units and do all the fun drips and things. Um, but because new grads, they bless their hearts. I was a new grad. Every nurse that's ever been has been a new grad. So it's a struggle when you first start. There's a steep learning curve that nursing school just can't quite get you ready for. And so whenever I was graduating and getting looking around, all my instructors like, you don't even need to look at critical care. You need to get med surge first, get all your skills solidified, get a good routine going, and then maybe if you really like it and you're doing really good and you've gotten good at the less critical patients, then you can start looking at critical care. And I was like, okay, that makes sense. But to be honest, and I love my med surge folks out there, I am not, well, God bless you people for sure. But med surge just, oh, it hurt my soul. I was like, it was so monotonous. I was like, I can't do this. I don't like med surge. So I graduated and I was like, they told me to do it, but what happens if I don't? I mean, what's the worst that could happen? And of course, the little tiny part of your brain's like, someone could die. I'm like, well, hopefully not. But I was able to get a job in critical care. And I mean, the learning curve is still steep. It's just a little bit steeper than whenever you go straight into med surge. But you are learning things very specific to that unit.
Mhm,
So you're just skipping a step, so to speak. And
mhm.
it was hard, and I cried several days on my way to work, but I probably would have done that too at med-surg as well.
That's right.
So I think that's probably where it's all coming from. The older generations, like, you have to pay your dues at the monotonous med-surg bedside.
But you know what? The reality, you were scared that you might kill someone, but the reality is that you could do that in med surg as well, right?
You can do it
Um,
anywhere.
Anywhere, if you don't have that critical thinking, and I think what critical care does is it does give you that critical piece. Does give you that critical thinking skills. So yes, for
Mhm.
sure. Now, you said that you were terrified of the doctors. And tell us a story about when you had to overcome that fear.
Oh, okay. Let's see. There's several. It wasn't like one big thing happened and I was like, I'm not afraid anymore. It was several instances that kind of led me up to it. As a new grad, I work night shift, because
Mhm.
that's where most new grads go into. And I'm all for night shift as a new grad. It's just a different pace. You get to learn at a slower pace. You can really dig into what's happening with your patient. So I enjoyed night shift, except for the fact that it took place at night and that anytime something went wrong, I had to call a doctor and wake them up. Okay. And I was like, oh gosh, I am super non-confrontational. And as a new grad nurse, I was like scared of confrontation. So I didn't like the idea of waking you to like, hi, wake up. I've got a question for you. It terrified me. And then to accompany that with some social anxiety I was dealing with because I was in a new work environment. I didn't know everybody yet. So anytime I had to interact with the doctors, they were all in a hurry, 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 rush, rush, rush. And I'm just like, oh no, So it finally got to a point where I had some patient situations where it was almost like it narrowed it down to where I had to choose sides. I was either on the side of the patient and I was willing to do whatever I needed to do to get that patient to the best outcome, or I was on the side of the doctor and I wanted to not bother them, make their life as easy as possible, and all that stuff. And so it kind of became like a fundamental battle of wills inside my head. Like, do I listen to this anxiety, socially awkward person that says, no, 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 don't talk to anybody, don't aggravate them, make you wait till the morning, or do I do what I need to do? And so there were several instances where I had a patient that turned critical because I was actually on the progressive care unit. So it was still critical care, but it was a slight step down from the ICU. So I would be able to advance my patients up to ICU if I needed to, but I had to have an order to do it. And when you call and wake a doctor up in the middle of the night, especially as a new grad, you're still learning how to talk to them, how to get that flow of conversation. And now it's just I would straight up say, hey, I need to move this person to ICU because of XYZ. Whereas back then I was trying to get them to make that decision for me without coming right out and asking about it. And there was this one particular doctor who, bless his heart, he mumble talked when he was wide awake. Like, and you could not understand him. Like, people who'd worked with him for years could understand him, but I was just like, is he speaking English? What is this? And to make it even worse, his handwriting was atrocious. Like, we would have nurses on the floor like, hey, can you read Dr. So-and-so? No, I'm not good with that one, but I can read Dr. So-and-so. I'm like, all right, well, let me go find the expert specialist in this particular language so that I can figure out what this order is. So I had to call and wake this man up. And like I said, when he's fully conscious, he's barely comprehensible to, someone who's not used to being around him. And he's trying to give me medicine orders. And I'm still relatively new. I don't know all the medicines. I'm not 100% sure on what the doses are supposed to be. And so I keep going, you want 50 IV of metoprolol? He goes, no, I'm like, so 50 IV. And then finally I heard him say, that's a hell of a lot. I'm like, I know, that's what I was thinking. And so finally it got to the point I was like, you're just going to have to spell it out for me. Spell it. What, how much? Spell it. And he would spell out the words so that I could get what I was needed to get done. And finally we got to the point where I was like, listen, can I please just move this man? Please let me move this man. He's going nuts. I got to move him. And we were able to do that. So it was just, it kind of like, I got pushed to a point where my frustration with the situation and my urgency of needing to fix whatever was going wrong with this patient pushed me beyond the anxiety of talking to the physicians, and so I'm much better about it now because, now once you work with them for a while, you're like, these are just people. They make mistakes too. They've got lots of patients that they're seeing. So it's not personal whenever they don't know who I'm talking about. They're not trying to test me or trick me when they're asking me questions. So now I'm comfortable calling and saying, hey, I need to move this person to ICU because this is happening. But it took a while to get there. And there's still some doctors that I'm like, I don't know if I like you, but there's still, you got to work through it. It's the
right.
whole point of the healthcare team. You got to work past it. So it's just finally getting to the point where, whose side are you on? Are you on the provider side or are you on the patient side?
That's right.
And as nurses, we should always be on the patient side.
And the reality is that, if we work collaboratively as a team, then it's just a game changer, right? And I think that is the deal, because what happens is, I remember, my first encounter with a physician that I was really kind of had angst behind was a physician who I came up and I was trying to prevent him from going home and actually me having to call him back. And so I said, this patient is having chest pain. And he was like, well, did you get a set of vitals? Well, I was trying to get to him beforehand. And so did I get a set of vitals? No. But if the patient was having an in-STEMI, he could be having a normal vital signs. I mean, I need an EKG, right? Just give me the order. And he was just really, really ugly about it. And then I remember, because as you said, we used to have to read everybody's handwriting.
Oh,
hallelujah for computerized physician order entry.
Yeah.
Okay. It was a game changer for me, and it changed the way that I operated. And it was so funny because one of the ER physicians, because at this time we were not allowed to put in orders for physicians, which at one point in time we wrote the orders, right?
Yeah.
And we were not allowed to put the orders in. And so this particular physician, he was, like you said, he mumbled when he was wide awake, right? And so the ER physician was like, I know that we're not supposed to be doing this, but can you call him up and can you get orders from him? And I said, no, sir, I sure can't. I said, he gonna get ugly with, I said, I don't understand what he's saying. I said, and he's gonna get ugly with me. I said, and chances are I'm probably gonna get ugly back. I said, and chances are I'm gonna lose my job and he's not gonna lose his. Okay. So no, I'm not taking any orders from him. He's gonna have to come in here. He shouldn't have been ugly from the beginning, right? And he wouldn't have to do this. And it's not physician against nurse, but it is, we have to make those decisions in the midst of it and understand that our fear does not need to hold us back. And I think that is one of the things that has helped me in my entrepreneur career, because I don't have that fear. I don't, and
Mhm.
I work alongside physicians all the time, so I don't have that fear. And so it's just like, hey, let's work this out.
Yep. Yep.
So now tell us some story about some advice that your mentors gave you that was really impactful in your nursing career.
Oh, there's so much. I've been very blessed with some very good mentors throughout my nursing career. The best advice, there's 2 of them. One was never be afraid to admit you don't know something. Okay, because as soon as you think you know everything or you're afraid to ask for help on something, that's when you make the mistake that kills someone. So even if you have to confront the mumbling physician or the one with the short temper, always take that extra step and ask, because at the end of the day, you alone are responsible for your actions. And it's you that's going to be kept up at night going, oh my gosh, what would have happened if I would have actually done this versus this, like the little voice inside my head was telling me to do. So that was a big shift of focus for me whenever I was working bedside. Was you got to live with your actions when you get home. So who cares who's mad at you? Who cares if you look silly for asking a question that everybody else thinks everybody should know? Better to double check and be sure than to just fly by the seat of your pants. And then since I've gotten out of bedside, the biggest advice I've gotten has been, I don't know how to boil it down to like a succinct little cookie cutter phrase, but it's kind of along the lines of just stand up for yourself and be willing to put yourself out there, you know? Because I struggle a lot with self-confidence on some things. And so I will talk myself out of something before, like super fast. As soon as I'm asked to do something, I'm pro and con in it. I'm like, okay, looks like a lot of cons. That probably shouldn't do it. That's not an acceptable risk. But since I've been in education, I've been working with my current mentor. It's the worst people can say to me is no. So if I want to do something, I ask. I put myself out there. I apply for things. I volunteer for things. Now there are still times where I'm like, I'm not feeling that adventurous today. I think I'll pass up on that one. So I'm working at it a little bit every day. But that's a big one for me is don't set your own limits, if that makes sense.
That's
You
exactly
know.
right. Because you're literally, your life is limitless. You can do
Yeah.
anything, and especially as a nurse, because nurses are, just phenomenal beings.
Oh
I
yes.
really, I mean, if you can pass the NCLEX, if you can get through school, I'm gonna tell you, you can do anything you want to do.
Mm-hmm. Got that
Now,
right.
you were able to secure a manager job. What were some of the self-limiting beliefs that you struggled with in that manager role?
Ooh, let's see. It all kind of ties back to the same things where I was having issues communicating with providers. I was very young and I was the youngest person working at the place that I was in this manager position. So I show up and I'm like, oh no, I have no semblance of authority. Not that I ever took a manager position to go like, I'm the boss. Look at me. If anybody's ever doing a manager position because that's what they want to do, they are the exact opposite of who needs to be in a manager position. But so I show up in this brand new environment, people I've never worked with before because I got hired specifically for this nurse coordinator job.
Mhm.
And of course, I get this, you're too young. You don't have enough experience. These people have been working here for years. They don't need you. Who are you to come in and try and change the way they do things? But then I had to fight back against it internally and go, okay, I recognize that they've all been here. They have their little work ethic and work group, and they're fantastic people. But obviously, they need me for a reason. Otherwise, I would not have been hired. So I had to fight against that and just make little changes at a time with lots of input from everyone around me because I did not want to go in with any type of, totalitarian type of managerial approach to this, like you do it this way or no way, that never works.
No,
Um, yeah,
no.
but the biggest ones was related to my age and my lack of experience. Because at the time when I got that job, I think I was 24, 25, I think. I
Wow.
went straight from bedside to nurse coordinator of that clinic. And so it was a different environment, a different type of work, a different everything. But I knew it was where God wanted me to be. And so I wasn't going to let anybody stop me from doing what I could to improve that place as much as possible.
And I think that one thing that I think that young people, at 24, because you're young, you're at the age of my daughter, one thing that young people can bring to the stage or the game is your ability to be able to broadly um, be able to have that technological standpoint of things, right? And
Mhm.
because you can be taught the other aspects of it, but that technology is something that we have to embrace it in these days, and that's something that young people definitely bring to the stage. And just not having that self-limiting belief that probably struggled with at that time. I know
Mhm.
some people that I mentor that have that self-limiting belief because they're younger, but you guys are phenomenal. I mean, you're good with change. You're good with change management because you change on a dime. You don't let anybody limit you based on your age, and that is cool. Now, what is some leadership advice you would give someone going into leadership management for the first time?
Um, well, just to kind of go back on what I just said a minute ago, like, don't think that the title gives you the right to their respect. It doesn't. That's literally just the name of your job. So, being in a management role, you have to be familiar with what everybody else's job is, and you have to be able to value everybody else's input. You can't just jump in and take over because that's not what leaders do.
Mhm.
Um, and another thing is, I think it's at least the people I've always worked for, and something that I've tried to embody anytime I'm in a leadership type of position, is always be willing to do more of the work. If the people you are managing see that you are busting your butt and you are not afraid to shy away from, I mean, not afraid, not, oh, sorry, got that a little twisted. And you're not shying away from any type of activity, no matter if it's on the tech level, the nurse level, the floor manager level, whatever. The more willing you are to jump in and help, that sets the attitude for the whole team.
Is that correct?
Um, so that's the best advice I think I could give.
Yes. So now you talked about imposter syndrome. Break down imposter syndrome in your most basic terms and how were you able to overcome it?
Well, I'm still fighting it, so I don't know if overcome is the the correct thing. Because even this morning when I got on this thing, I'm like, "What do I have to say that anybody wants to hear? Who are you? Calm
Like you
down."
have been phenomenal the whole time. Go ahead.
But anyways, so thank you, I appreciate it. Um, Imposter syndrome is, simply put, is feeling like a fraud. It's that little voice in your head that goes, "You're just faking this. They're gonna see through you eventually. You're not as smart as you think you are. You're only pretending to be a professor or an instructor. You're only pretending to know how to lead this group of people." And it's been very difficult, because it's just it. I feel like it's all linked back to my age right now. Of course, I'm slowly getting out of that whole "you're a really young person" type of thing, which is kind of heartbreaking to me, but I don't want to talk about it. Um, so it's just, I'm
You either
teaching
get
a
older or you die.
yeah,
So
I know, but still, I'm coming up on 30, and it's hitting me right in the heart. I just don't know what I'm gonna do. Anyways, this is I'll save that from a therapist. Um, but anyways, so the self, it's constantly fighting that inner voice that tells you you're not good enough. You're pretending. You're just playing a role in your everyday life. That one day people are going to wake up and go, "What the heck is this person doing here? She does not belong." And like I said, I related a lot to my age, and I don't have the decades of experience that these other wonderful nurses have that I'm working with. Um, but I just got to constantly remember there's a reason I have this job. There's a reason I am where I'm at. I might not have the bedside experience that everybody else has, but I have different perspectives. I have different things that I can bring to the table to make up for that. And I'm very much a believer of God's got a plan for me. So I'm just trying my best to go wherever He tries to put me. And so far, I can tell you, it's been very clear that it's been very stepwise where He wants me to be. And so I just kind of keep coming back to that there's a reason I have this job. I am not faking my degrees. I earned those degrees through blood, sweat, and tears. Those are mine. Those are not fake. And it's just like I said, it's everyday battle. But I have to keep coming back to the just tell that little tiny voice to shut up and just go to work and do it anyways.
Because,
So,
I think that one of the things that, people don't realize, and I didn't realize this at first. I didn't realize that I bring a unique perspective to the
mhm,
table. Very unique, right? Because
mhm,
I'm the only person who has been me. I am the only person who has experienced the things that I've experienced. And I can bring that to the table. I remember walking into a patient's room, and she was just really, really scared. And she was scared because nobody in the room looked like her. Okay. And
mhm.
I walked into that room, and she was like, "Come here, come here." And I walked over there, and I got there. She was like, "I want to go home. I want to go and get my mama." And I was like, "Yeah, you can't go." And she was tombstoning. And we all know what tombstoning
Mhm.
means. Tombstone means that if we don't get you in the cath lab real quick, you're gonna have a tombstone, right?
Yeah,
And so
yeah.
she was tombstoning, and I said, "If you walk out of here, you won't walk back." And so she said, "Well, okay." I said, "I'll stay with you until you get to the cath lab." And I stayed with her till she got to the cath lab, and she had a 100% occlusion of her LAD,
Woo.
right? And
Oh, wow.
which is the widowmaker, right?
Yeah,
And she
yeah.
wouldn't have made it back. But the reality is that I bring that unique perspective, right, to
Mhm.
that room, right, at that time, in that moment. And so
Yeah. You had a role
understanding.
to fill.
Exactly, exactly. And so, understanding that imposter syndrome is something that, we have, because I'm going to tell you, I have dealt with that for sure. Now, tell us a story about, you're an instructor now. Now,
Mhm.
tell us a story about a student encounter that changed your life and the life of the student.
Ooh, let's see. Um, the I have a lot of them that come up. It's kind of like the light bulb moments, when you have a student that's been struggling for so long to understand this one specific thing, and then all of a sudden it clicks and there they are. I actually had this past semester, I teach in the classroom and I also teach in the clinical setting as well. So this past semester, I had a phenomenal clinical group. However, they were really weak because they didn't get a lot of exposure during, the whole
COVID.
COVID shutdown and everything. So they
Right.
were timid and scared. They didn't know what to do when we first got on the floor. So it took a lot of work to get them to where they were even comfortable being around patients. And so one thing that really stuck out in my mind this semester is we actually had a patient code while we were on the floor, and it was me and a student that discovered it and initiated the whole thing. And just seeing my students run in and jump straight on it. I had a student flatten in the bed. I had another student come in and started doing compressions. I didn't have to tell them. They jumped straight in and did it. And I was like, "This is so good. Look at my." Like, we finished and I got outside, I was like, "High fives all around. Way to go, guys. This is fantastic." So it's just those moments, where you see, like, it's and then afterwards, when we had post conference, we talked about it, and that student that was doing compressions, he came out, he goes, "Did you see me doing compressions? Did you see that?" I was like, "Man, I saw it. I was right there. You did so good." And it was just, you can see like a fire had been lit, that there was a whole new passion in these students that just ignited because of that experience. And so it's things like that. That's the most recent one for sure. That I've been bragging about my group since we started that code. But yeah, it's a proud mama moment is what it felt like for me.
I love it. I love it. I
Yeah.
love it. And it is a proud mama moment, right?
Yeah.
When you see
Yeah.
them go out and you see them work it out, it is just an
Mhm.
amazing thing. You have been phenomenal.
No, thank you.
Absolutely phenomenal. You are too funny to me.
Oh,
I love it. I love it. So, thank you, thank you, thank you for showing up today. I'm just really, really thankful for you. So, my name is Dr. Viola Pierce. I'm the owner and CEO of VP Nursing and the nurse nurturer and the facilitators of Secret Suppers Worldwide with Dr. V, where our goal is to teach nurses to leverage the knowledge that they already know working from their computers around the world, making money and owning their own time. Our goal is to come to you each Monday, Wednesday, and Friday at 7:30 a.m. Eastern Standard Time to give you the fuel to crush your goals, to show up exceptional on a daily basis. Know that one of the goals of Morning Infusion with Dr. V is to expose you to leaders such as Megan that have overcome so that you know that the possibilities are endless. If you're watching on YouTube, don't forget to hit the subscribe button and leave a comment if you were ever told that you would not succeed. And we have another cohort of VP Nursing Business Academy. It is starting in July. So go ahead and click the calendar link if you want to create another stream of income and enroll in our 12-week course, VP Nursing Business Academy. You guys have a phenomenal rest of your day.